Okay, so hi, I am Miss Collins. I am the lead teacher on the Applied Medical Science course that we run at Crompton House. It is a level 3 certificate/diploma, depending on how well you're doing it. We're hoping you all get the diploma. The main purpose of the qualification is to give you the skills, the attributes, and help you develop and progress into higher education, especially in regards to life sciences and the medical aspects of it all. The one thing that you need to be aware of is that there is no plant biology, it is only human biology in this course. So we are only looking at a human. You are given a study pack and a question booklet at the start of every topic that we work through, which means for your revision and your self-study, you've got some really good independent learning there to help you. Each topic has its own end of topic test so that we can assess where you're up to and what we need to do to help you. What you study, there are going to be 6 units that you study, hopefully 3 in year 1 and then 3 in year 2. The first topic is synoptic, so it actually comes and covers all of everything that you need for the entirety of the 2 years. We're looking at health and disease. So this is your theory-based things. These are your diseases, your cells, your biological molecules. The second unit is the physiological measurement technique. So this is where we look at blood pressure, we're looking at peak flow. You are actually going to take part in doing those tests, and you will run that like you are a clinician in the healthcare sector. Unit 2 is the physiological measurement techniques. This is where we look at blood pressure and things like peak flow and ECGs. And this is something that you would actually physically do as if you were working on a patient in the healthcare sector. This is an internal coursework, so it will be marked internally and that will contribute towards your grade. The third unit is medical science research. So this is where you will look at quantitative and qualitative research. An example would be e-cigarettes, and you would perform a questionnaire and you would be asking round to get some evidence to help support your theory. Unit 4 is medicines and treatments of diseases. So this is where we look at one of the topics such as oncology, which is cancer, and how we can treat that and help research that. Unit 5 is the clinical laboratory techniques. So this is where we look at things like blood sugar testing, microbiology counting bacteria. This is an externally assessed coursework. So this is actually, you'll do the coursework in school, but it'll be sent out to be marked. And Unit 6, the final unit. This is the medical case studies unit. So this is assessed at the end of year 2, along with Unit 1, which was synoptic overall. You get given the medical case study before the exam, 4 weeks before, which means we can talk through it. We can talk about what kind of questions you might get asked. How can you prepare for applied medical science? What I would like you to be doing now is to be looking into the medical side of biology, things like ECGs, blood sugar, diabetes, things that you maybe don't cover as much into year 11 at GCSE. As you come into year 12, you need to be aware of these kinds of topics. We can also go to a medical festival, which is where we can look at careers and also use specialist equipment that we necessarily might not get to use in school. And finally, this course is perfect for you if you want to take a route into higher education in regards to medical research, microbiology, physiological sciences, anything that would help you medically, especially the research field. I can't wait to meet you when you start 6th form, and don't forget, keep studying.